Hi, it's Dr. Bruno here. I just want to go over a couple topics with regard to your post-op recovery from your surgery. These are some commonly asked questions and commonly asked topics that come up, and I think it's important to review them. The first and probably the most important thing is in your immediate post-op recovery is have someone with you, whether that's a friend or family member, who's going to be able to stay with you for at least 1 or 2 nights and look after you, and they may even need to drive you to your post-operative visit, which usually happens on the first or second day after your surgery. Secondly is the diet, and what can you eat after surgery? Most patients for the first 24 hours, they're eating a light diet, like a liquid diet, soup, toast, crackers, sports drinks, and smoothies and the like. After the first day, when the anesthesia wears off, then most patients are ready to have more traditional, solid foods. When can I shower after a surgery? Most patients, regardless of the procedure that they've had done, can have a shower or take a shower in the first 48 hours. In other words, everything can get wet, all the incisions, after 2 days. How do you sleep after surgery? Well, depending on the procedure, most patients are still going to be sleeping with their legs elevated and also with their lower back elevated. In other words, you'll want to have a pillow under your knees and 1 or 2 pillows behind your back such that you're in a semi-flex position. The only exception to this is if you're having a fat transfer to the buttock, in which case patients will be sleeping on their stomach for the first 2 weeks to avoid any pressure on the newly transferred fat cells. Another area is activity. We highly recommend patients to be walking and moving around as early as the first day after surgery. It's important to move around, even if it just consists of walking around your living room, walking around the kitchen. It's important to promote good circulation to prevent any blood clots. So that's a very important topic, is walking, regardless if you had breast surgery, tummy tuck surgery, or liposuction. The medications. You're going to be prescribed several medications prior to your surgery. Those will consist of a pain medication, a muscle relaxant, as well as an antibiotic. It's important that you have these prescriptions filled prior to surgery and that you actually bring the pills themselves with you to the surgery center in the event that you need to take any pain medicine on your ride home. And that's something that will be reviewed with you again before surgery, and if you have any allergies, that will be noted as well and taken into consideration when we prescribe your antibiotics. Patients will also ask about, how do I take care of the incisions? Is there anything special to do for the incisions? Well, after the first 2 days, the incisions can get wet, as I previously mentioned, and then there's going to be some white surgical tape on the incision. This usually falls off in the first 7 to 10 days, beyond which time you can apply a silicone gel, which we'll provide for you, which helps improve healing and helps lighten the color of the scar and also helps improve the quality of the scar. Some patients may have some surgical drains in place after their procedure. These typically stay in place for about a week. The nurses in the recovery room will show you how to care for the drains, but you'll basically be emptying them several times a day for the first week, and you'll be recording the amounts. Each drain will have a different amount. In other words, the left side will have a different amount each day compared to the right side, and that's completely normal. Sometimes one drain won't put out much at all, and that's also normal. But usually on the 1-week visit, we'll evaluate how much the drains have put out, and I'll remove the drains here in the office. Patients also ask me when they can return to work. Well, this is related to, one, when are they going to finish their narcotics? If you're having something like a breast augmentation, most people are off the pain medicine in about 3 or 4 days and then can resume driving and return to work. Other patients, if you're having a tummy tuck, for example, they may need about a week off from work and a week's worth of narcotics. But essentially, once you're pain-free and you're only requiring over-the-counter medication such as Tylenol, that's typically when patients return to work, which again is anywhere from 3 to about 7 days. Hopefully this helps answer some of the more commonly asked questions after surgery. Should you have any other questions, we're always here for you. Feel free to call us at the office.